A La Crosse area needle exchange program for drug users may take on a new role after a record number of needles were handed out this year. News 8's Eric Jacobson joins us with more.
Lisa, the AIDS Resource Center runs a needle exchange program to prevent the spread of serious diseases like HIV and hepatitis C among drug users. So far in 2016, the center has handed out about 300,000 needles in La Crosse compared to only 11,000 in 2008. It's a staggering number for city leaders, but changes could soon be on the way to help reduce that number.
I'm shocked. I mean, it's a shocking number.
The news that around 300,000 needles have been distributed in La Crosse has left city leaders ready to take action.
With that many used needles around our community, there's an environmental issue as well as the public health.
We at the La Crosse Police Department do believe it's contributing to the issue that we experience on a daily basis of unsafely discarded needles in public places, parking ramps, parks, people's backyards.
But even more concerning is how many needles the La Crosse Police Department are finding.
Last year alone, we had taken approximately 36 pounds of discarded needles to the hazardous waste dump ourselves. Well, the average empty needle is like less than 0.1 ounce.
It seems like La Crosse is the only area where this is consistently becoming a problem.
It's why city leaders and the AIDS Resource Center met last month to discuss ways to reduce the number of needles found on the street.
Well, they have been in meetings, they have come to the table.
Instead of dispatch calling the fire department and a fire squad responds to discarded syringes, we're asking that maybe they can call us first and give us the first opportunity to go into the community and pick up the discarded syringes.
Other ideas brought up at the meeting include creating needle drop-off sites.
It's very similar to our, prescription drug drop-off that we have here. Is there a possibility of having a needle drop-off?
The open communication between the groups have provided a sense of optimism.
Anytime that you can bring a couple different organizations together that are key stakeholders to address a problem and try to be proactive about it, I definitely think there's a way that we can improve the situation in the city.
Now, there is no set timetable for any of these changes, but city leaders are hopeful to see an improvement in those discarded needle numbers for next year.
What other solutions to this problem have been discussed?
Well, the AIDS Resource Center has expressed their desire to brand their needles so that they are better able to identify them if they are found on the streets. But city leaders have also expressed the desire for the center to provide more resource in preventing drug use for when they hand out the kits.
All right, thanks so much, Eric. We appreciate it.